Good morning. I would like to start by thanking WXXI for hosting us here today in their studio. We're doing today's press conference a little different than the way we've been doing them in the past because as we try to do, we're going to lead by example and practice good social distancing techniques to make sure that we can meet the needs of the community and we can get information out to everyone, but then at the same time, we can make sure that our healthcare professionals who want to answer our questions, get information out to the public, are also remaining safe themselves and practicing safe social distancing techniques, and also for the members of our press corps here so that we're not all jammed into the same room. So the way today will go is I have some information that I'm going to share here first this morning, and actually we're going to pause for 1 second. We have an okay? I think we're having some audio issues that we'll just fix in 1 second. Can everybody hear?
Can you guys hear?
I think people have their lines not muted. Or maybe it's on your end. Is your line muted too?
Not now.
Yeah. I cannot hear. I only hear what you're saying.
Can you hear that?
No, it is not loud enough.
Is that better?
Okay. Should we start again?
It's not ideal. It's hard to hear.
Oh,
Okay.
so
well,
we should be
we're trying
testing
this,
it.
So we're going to have to live with not ideal for a moment. We're doing our best, and we'll work with WXXI.
All right, so we're going to, should I keep going? All right, so we're going to try to do this, and I'd ask everybody to bear with us. This is the first time we're doing one of these, and I think it's unique this way, but this is important to be able to get this information out. So how this will work is I have some comments that I'd like to make about efforts that Monroe County government is doing. And then I'm going to turn this over to Dr. Michael Mendoza, our Director of Public Health, who will be able to provide information from the medical side of and provide an update from what we have in terms of coronavirus and COVID-19 here in Monroe County. We're also joined today by Dr. Mayo, Dr. Apostolakis, and Dr. Kevin Casey from the URMC and Rochester Regional Health and Rochester General Hospital. And we're also joined today by Corinda Crosdale, my Deputy County Executive for Health and Human Services. And the reason you don't see these individuals is because, again, we're trying to keep ourselves at a safe distance, so they're off camera, but as we ask questions and people speak, they will come up to the microphone. So what we're here today is to discuss the county's response and provide updates, and Dr. Mendoza on the public health side and the hospitals are also here to talk about their response as well. So first and foremost, I'd like to start today by asking every business owner and community organization and anyone listening to the sound of my voice now, if you are not providing an essential function to help the people in this community, such as providing food, gas, and health care, I am asking you to please send your employees home, and it's time to start practicing social distancing. If you are a community organization, a neighborhood group, and you have planned gatherings or meetings, today is the day to cancel those meetings. We will be considering executive orders as the days go forward to make this happen if we can't have cooperation from the public. Just yesterday, I heard more examples of neighborhood and community meetings that are still taking place throughout our community. The time is now not to do that anymore. Social distancing and the message that we're getting from our healthcare professionals and the leadership throughout this community is that we need to protect the most vulnerable people in our community. This isn't about me, and it's not about the vast majority of these people who, if they got the virus and became sick, will be okay. This is about the most vulnerable people in our community and making sure that we protect them from the spread of this disease. So in Monroe County, we will lead by example. Today, I'm going to sign an executive order that will shut down county government for non-essential employees, and our essential employees who can work remotely from home will do so. It's time for our community to step up and to give our local, state, and federal officials time to continue to plan where we're going on their regional and national approach. But please think about where you're going and what you are doing. Do you really need to go see your mother or your grandmother tonight? Can you FaceTime with them? Can you drop groceries off at the porch and then call them afterwards? Do we really need to be getting together? The time is now to start thinking about these things. This morning, I also signed an executive order related to county facilities. Beginning no later than 6 a.m. tomorrow, no individual, community member, or county employee may enter the 17 different county facilities without first going through a screening and temperature check. To facilitate this, we're designating entry points to each of our buildings. And this is part of our ongoing efforts, again, to promote social distancing and maintain the health and safety of our community and our essential workforce. We also have some updates on social service delivery in our community. Led by the United Way and the Rochester Area Community Foundation, we announced the other day that they have come together to support organizations and the not-for-profits that are reaching out to neighbors in need and taking care of them during this challenging time. Just 24 hours after launching this initiative, they raised over $1.5 million, led by a $1 million contribution and commitment from ESL Charitable Foundation. This is an unbelievable community response. This was after local foundations pooled and dispersed an initial $260,000 donation to FoodLink to help them address the immediate food insecurity that resulted from school closures. United Way is also shepherding volunteers to organizations that need them and cooperating and coordinating the nonprofit community so they have the most up-to-date information and can troubleshoot any issues that arise. And this is, again, just another great example of where I keep talking about how we will get through this as a community if we all do our part to help each other and spread the right message. And this is a great example of our community organizations, our nonprofit community, and the leadership coming together to provide that support so that individuals can stay at home and the vulnerable folks in our community get the resources they need so that they can stay in their homes. I also would like to, was pleased to announce that yesterday, with a collaboration between the Monroe County Department of Health and the New York State Department of Health, we launched a collaborative effort to get and deploy strike teams out into the community. These strike teams will each have 2 state-certified medical professionals and a driver, and they will be able to perform in-home testing for COVID-19. The health department will be able to direct these teams to high-risk individuals based on their continued investigations into positive tests. By sending them directly into homes to perform testing, it will dramatically reduce the risk of any individual that needs to be tested, potentially exposing other individuals to COVID-19. And I'm very grateful to the Governor Cuomo and the State Health Commissioner, Dr. Zucker and Dr. Mendoza, and the dedicated medical professionals and first responders who are working hand in hand in our community to keep us safe and healthy. So before I pass this along, I do want to just reiterate what I said at the beginning. I am asking everyone in our community to start practicing what we keep saying over and over, which is social distancing techniques. If you are not performing an essential function and providing essential services to individuals in our community, particularly those who are the most vulnerable, I'm asking you to stay home, to take precautions to protect, again, the elderly and folks in our community who are otherwise compromised, and in the outcome of receiving this disease would be far worse. We're asking you to stay home, to please remove yourself from public gatherings, and now is the time to do that. I'm now going to invite up to the podium Dr. Michael Mendoza from the Monroe County Department of Health, who will provide an update on where we are in Monroe County with the cases of COVID-19 that have been identified. Thank you.
Good morning, and thank you, County Executive Bello. I want to offer an update today as to where we are with regard to the COVID-19 outbreak here in our community, and then shed some light perhaps on the testing process and paint a picture of where I think we need to go heading into the next days and weeks. As we announced this morning, we have 4 new cases of COVID-19 in our community identified just late last night. That brings the total in Monroe County to 18. We currently have 5 individuals hospitalized. We heard, unfortunately, yesterday of our first death in our community, and I think out of respect to that family, I think we want to owe them every bit of respect and privacy that we can. We also have 142 individuals currently on quarantine, and as you can imagine, that is perhaps one of the most important functions that we can provide to the health of this community. And it is also becoming a very important task that is taking up a considerable amount of time on the part of our staff. So to put that into some context, I want to review again the process that we undertake when we hear of a result. Because of the variability in how tests are being performed both here in this community as well as across the region, the results from tests come from different locations and at different times. There is no one consistent way that we've been able to learn about these results. And typically we'll get a result with the name of the individual on it, and then the process begins to identify that person, contact that person, deliver that result in most cases, get their contact information and so forth, and then we begin the process of interviewing them. And typically what happens when we get these results after 7 o'clock at night is that the priority in that interview is to identify any high-risk contacts or any high-risk places that person may have visited beginning on the date that their symptoms began and going forward. Because we are getting currently results that were done very recently, that window of time of potential places that individual could have gone to is much smaller than it was before, which is good. And the other point I'd point out is that when we're trying to assess what is high risk, the calculation of risk is different because we're in a very different point now in this situation than we were a week ago. The understanding, the expectation now is that people will stay home if they're sick, that people will practice good social distancing techniques. And so how we determine a place as being high risk is very different. If in the case of the Greece School District, if it's an individual in the Greece School District, we now know that the Greece School District is closed. And so we don't currently believe that if somebody was in the Greece School District that that's going to be the same level of risk that it was a week ago.
Okay, you guys, could we just proceed so we can get through this, and we will iron out the details afterwards? And yes, if you could type just a little bit farther away, we will remedy this for the next time, and please let's let Dr. Mendoza continue.
Okay.
Thank you.
Thank you. I appreciate your patience. We're working through this together. Once we have identified the higher risk contacts, the next step is to begin the quarantine and isolation process as appropriate, and that is the process that is becoming quite substantial currently and going forward as we identify more cases. I do think that the focus now needs to shift very rapidly toward mitigation. We've talked about social distancing, we've implemented closures of schools, of bars, of restaurants. We need to take that very, very seriously going forward, because the social distancing tools are really the most effective tools that we have available to us to mitigate the spread of this illness. To that end, if you are on quarantine, we ask that you please take that seriously. We are hearing reports of individuals who are on quarantine who are out in the community, and that is a very real risk. People who are under isolation, we take very seriously. If you are under isolation and we discover that you're not where you ought to be, we will take swift and rapid action in response to that. But for people who are under quarantine, we simply ask, please, that you cooperate with us on that. I want to close with a few comments on testing. Testing has changed quite rapidly in the last day to 2 days. We earlier reported that we were able to keep up with the demand for testing. In the last 2 days, we've had a large spike in demand for testing, and now we are no longer able to keep up with all of the tests that are being collected. And so in the interest of health care and providing good medical care to the individuals who need it the most, we are prioritizing the processing of specimens for those individuals for whom the result will make a difference in terms of their clinical management and the public health investigations that we are undertaking. I want to remind the public that 80% of individuals who contract this infection will experience little to mild symptoms. And so you do not necessarily need to have a test to confirm that you have the COVID-19 infection. If you are experiencing symptoms, we ask that you stay home, that you practice the precautions like hand washing and social distancing, as though you have COVID-19, and then we can confirm it later as appropriate. But the most important point is that if you are ill, please isolate yourself so that you do not get somebody else ill. Remembering that 20% of the individuals who become ill with this will have moderate or severe symptoms, and those are the individuals that we need to be looking out for the most. So with that, I will turn the podium back to the county executive, and we'll entertain some questions.
Okay, thank you, Dr. Mendoza. The way this will work is that reporters have the ability to ask questions through my communications director, Julie Phillip, who can then pose those questions to all the individuals who I had acknowledged who are here today, and we will get through as many of those questions as we can.
Okay, we're going to start quickly here. First up is Kayla Green from News 8.
Yes, so I have a question about the first death. The family told us that the man came into the hospital for treatment on Wednesday the 11th and was diagnosed with pneumonia and sent home. And I just wanted to see if you guys could confirm or deny that, or just talk a little bit about the timeline with what happened with him.
I'm Dr. Kevin Casey. I'm the president of Rochester General Hospital. Reviewing the records on this patient was an employee at Rochester General Hospital. He worked in our environmental services group. He was a team member at Rochester General. He had worked at Rochester General up until the 12th. The 12th was his last day working at Rochester General. He had started with us as a new employee less than a month beforehand and was still in his new employee orientation. We saw him in the emergency room at Rochester General on the 13th. On the 13th, he was seen and evaluated in the emergency room. He was discharged from the emergency room, but identified as a patient under investigation. During that visit, he was judged that he was clinically stable to go home. He presented back to Rochester General 18 hours later. He was in respiratory distress and brought in by emergency medical services. He was rapidly intubated in our emergency room, and he was taken care of the rest of his hospital stay in our intensive care unit. This was a very difficult process for the people taking care of him. Very difficult because of being the first COVID positive patient at Rochester General. We were prepared for that, but he was also a member of our team, and that emotionally was very difficult for the members taking care of him. I express my sincere sympathies for the loss to this patient's family. When he came to the emergency room at his first visit, COVID testing was sent. That went to the state lab as Rochester General's tests had not come up yet. Those tests returned after over 48 hours later. So we did not know that the patient was COVID positive at the time of presentation to the emergency room, but identified that while he was in the hospital. We initiated immediately with that a look at contacts within the hospital, looking at potential risks to both employees and to staff. That was, the initiation of that process started as soon as that patient came in as a patient under investigation. That process rapidly identified that we had no high-risk exposures. That was largely due to the fact that this employee was still on an onboarding process. We could trace the work that he had done throughout the hospital. We identified no patients who were at high risk. We identified no staff members who were at high risk. With that, I'll step aside for another question.
Do you have a follow-up, Kayla? A brief one?
I do have a brief follow-up. So just to clarify, was he working in an area of the hospital that potentially did have a coronavirus exposure?
So, excellent question. He was one of the first patients in Rochester identified with coronavirus. Rochester General had no coronavirus cases at the time that he came in. We had patients under investigation who we had testing going on, and those individuals all were negative. This was the first index case at Rochester General. We worked closely with the health department to identify if there were any other exposures or risks. The health department continues to work on that. Dr. Mendoza can address that if there are further questions. But this was felt to be a community-acquired case of coronavirus.
Thank you. Next up is Wendy Wright from Spectrum News.
Yes, thank you. I have a question in regards to the staff at Rochester General. How many are under quarantine? We're hearing more than 30, and I'm wondering if that's the case, and what the impact would be for the healthcare system, and how are you managing it? If you have a number of people who are in quarantine, how are you supporting this staff?
We have received very good guidance from the state of New York that we are using to identify patients in 3 categories: low, moderate, and high risk. There is a protocol that is followed in each one of those categories that addresses what the precautions need to be around those patients working in their environment, what individuals, the high-risk individuals that have to be removed, and when they have to be removed. We have, I can't confirm whether it's 30 or not, but we have a number around that number who are in quarantine. We have individuals who are being cleared to come back to work. We have individuals who are working masked because of exposures, because the state has identified that in those low-risk individuals, they may work while being masked. All of those employees are being monitored with temperatures daily. Dr. Mendoza can talk a little bit more about the testing that we ask for individuals who are on home quarantine, but we continue to have adequate and safe staffing at Rochester General. As a healthcare system, we have been able to take advantage of where we have employees in areas that have closed down to be able to use those employees to backfill areas throughout our healthcare system that are stretched.
Thank you. Do you have a brief follow-up, Wendy?
Yes, it's in regards, along the same line. There's been discussion at the federal level and the state level about capacity at hospitals and the number of intensive care units and respirators are available if they are needed. Do you have any numbers on how many respirators in our community are available, and how you are managing the potential influx of capacity?
Good morning, this is Dr. Mendoza. I think the most important point to make about the respirator and the ICU bed and the hospital capacity issue is that the steps that we're taking are the steps that we're taking right now. And the extent to which we are able to succeed in our efforts around community mitigation will determine whether we have enough beds and respirators and ICU beds. And so we need to work together now to ensure that the capacity that we have will be adequate for the need if and when it comes. We are not trying to aim at a particular number. We're trying to keep the number as low as we possibly can. So to the extent that we can implement good social distancing techniques right now, we can essentially pace ourselves with regard to the demand that we will place on our hospitals and our ICUs and our ventilators. I think it is very safe to say that if we do not take these steps now, we will greatly exceed the available capacity both here in this community as well as across the state and across the nation. So I would implore all of my neighbors and friends and colleagues here in the community to take the notion of social distancing extremely seriously, because that is how we will have any hope of being able to ensure that the capacity that we do have will go as far as possible.
Thank you. Patty Singer from Minority Reporter is next. Patty?
Yeah, thanks, Julie. Can you define the isolation versus quarantine? Are they synonyms or do they mean different things?
Thanks for your question, Patty. Isolation refers to individuals who have symptoms, who are either confirmed to be COVID-19 positive, or who have a test pending, or who may not even have a test pending. Isolation refers to individuals who have symptoms, and people who have symptoms we need to treat as though they may have COVID-19 until we know otherwise. And so isolation represents the higher risk individuals here in our community because those are the people who are much more likely to spread the infection because they are already showing signs of the infection. Quarantine refers to people who have an epidemiological risk but do not currently show symptoms. And so we are paying attention to them as well, but obviously they fall into a little bit of a lower risk category than those who are under isolation. But we follow people who are under quarantine to see if they develop symptoms, because if they do, then we put them into that higher risk isolation category.
Okay. So quarantine comes before isolation then?
They're parallel. You know, we may learn of somebody with symptoms from the beginning and they're immediately in isolation. So ideally, we'd like to find people in quarantine first, but sometimes that's not possible.
Thank you.
Okay.
Steve,
And the follow-up
Patty, out of respect for everybody, we're going to just do one follow-up.
Yeah, I just wanted to...
Thank you.
Okay.
Steve Orr, I can get your question after. Steve Orr from the Democrat and Chronicle.
Yes, Dr. Mendoza, what can you say about the state of knowledge as to where this gentleman who died at Rochester General might have acquired the virus? Are you certain it was not acquired at the hospital or that he did not pass it to others at the hospital?
Based on what we know relative to his date of first symptoms, I think it's very unlikely that he developed, that he acquired this infection in the hospital. So therefore, I would believe it's a community transmission as well.
Follow up, Steve?
I mean, can you explain why the timeline makes it unlikely, very unlikely?
I'd have to look at my notes again, but his date of first symptoms was 3/11, and from what I recall, he was not in the hospital in that period. And so when you look back at the patterns that we've been seeing here in the community, my belief at this time is that he acquired the infection outside of the hospital.
Thank you. Next up is Tanner Jubinville from 13 Wham.
Hi, yes, thank you. Wondering for a question for Dr. Mendoza. Were hospital employees who came into contact with this patient who died, were they wearing PPE from the outset?
The patient as was identified as a patient under investigation when he arrived in the emergency room. There were 2 employees who were exposed during his intubation because it was a crash intubation because of the illness of this patient. Those individuals were identified as high risk and were taken out of work at that point. So it was due to the acuity of illness of this patient that occurred. He was identified by EMS as a patient under investigation, and that was carried over to his presentation in the emergency room. But as a matter of how ill he was at intubation, there were employees who were exposed.
Do you have a
follow-up I had to that? Perhaps this is better for Dr. Mendoza, but is there currently enough PPE for healthcare workers in local hospitals?
So on the question of whether there is ample PPE, I think, again, we need to prioritize the PPE for those settings and individuals where it is most necessary. We have been in touch with the state. We still have a local stockpile of supplies that we have not yet deployed. We are in the process of prioritizing those to those areas of most need. I want to re-emphasize that healthy individuals do not need to wear a mask. People who are at home who may or may not show symptoms do not need to generally wear a mask. The goal in those instances is to remain home. That's how you keep people safe. Masks and PPE and so forth will be necessary for trained professionals in a healthcare setting.
Okay, I just want to clarify too that the first person to answer your question, Tanner, was not Dr. Mendoza, it was Kevin Casey.
Correct.
Next.
I saw. Thank you.
I just wanted to make sure everyone's clear. This is remote.
Right.
Our next up is Jennifer Lukey from, I believe, that's who's on from News 10.
Yes, good morning. Dr. Mendoza, you just mentioned that you can no longer keep up with the demand for testing in our community. How many tests have been given in Monroe County, and of that, how many have been positive? I think that's some important context, that we've heard from a lot of our viewers is they want the test, but they can't get it. How many tests are available, and is that number increasing daily?
So we've had 18 positive tests that we know. The denominator is obviously the question that people are trying to understand. And that is obviously a function of our ability to both collect the specimens and to process them. Because the tests are being performed in a number of locations, Erie County, reference labs like Quest and LabCorp, our healthcare partners at U of R and at Rochester Regional, we don't have a comprehensive database of all of the tests that were performed. I think the right context to think about the denominator in is in what proportion of tests will the result change our management? That is sort of the guiding principle when we consider ordering any kind of test in a medical setting. And so for an individual who may have symptoms, who will be under isolation for the foreseeable future, it may be that that person does not need to have a test right away. On the other hand, an individual who is in the hospital, under proper precautions and all of that, the test for that individual will very likely be of great importance. And so we want to prioritize those individuals so that we're making the best of our resources and ultimately preventing illness and managing illness. I'm going to be gathering with my partners in healthcare later today to develop a guideline to prioritize what types of tests we need to put toward the head of the line, and so that we can have a proper context to view what that denominator really ought to be.
Do you have a follow-up, Jennifer?
I do. We have heard from the family members of the gentleman who passed away, and they have some frustrations because they're claiming they're not getting clear guidance from the county or the hospital as to what their exposure risk is, what they should be doing, in this very difficult time for them. Who is communicating with these folks, and what is the message to those who have someone with COVID or someone they suspect with COVID? What is their message to those family members?
The message to this family is to remain at home under isolation, as it would be for any family who is experiencing symptoms. We have been in touch with this family. We're going to order testing as appropriate, but that will not change the guidance that we need them to be under isolation, because they have perhaps among the highest risk of people in our community. So we need to make sure that we keep those individuals safe at home and under isolation.
Thank you. We have Kevin, I believe, on from Rochester Business Journal.
Yes, thank you, Julie. A question, just wondering if there's any plans or hotel dormitories that perhaps have been identified in case that is necessary for hospital overflow. And kind of a two-parter, a lot of, like Wegmans, Walmart, they employ some older employees. Are there restrictions, guidelines for them?
So if I understand the question correctly, we're wondering about whether there are facilities available to quarantine individuals outside of their home. Is that a fair conclusion?
Yeah, the governor had mentioned that you might need to add other emergency facilities, be it for hospital, quarantine or, treatment of patients.
So to the first part about quarantine, yes, we do have, as part of our isolation and quarantine plan, an approach to try to identify alternate sites of quarantine. We have those plans underway. We're not prepared to release them because we want to make sure that all parties are on board. But that has been an issue that we've been looking into, and as you can imagine, it's not an easy offer for a hotel or a motel to take us up on. So that is something. If there are any hotels or motels out there who would like to step forward, please let us know. But we have several who we're under negotiation with at this time.
And your follow-up question, Kevin?
I was just also wondering if, because several employers employ some older, semi-retired people via Wegmans cashiers or Walmart. Have they been advised not to work? Are there precautions? Anything in that regard?
Again, with regard to the recommendations from our county executive, if you are in a non-essential function, please stay home. Particularly if you're higher risk by age or through a medical condition, please stay home. That is the most important guidance that we can offer to you all today.
Thank you. Final.
Thank you.
we have Brad from WXXI.
Hey, thanks, y'all. What is the criteria for prioritizing the testing, given that we can't keep up with demand right now?
So again, Brett, we're working on those criteria right now. And in general, when we look at testing, we want to prioritize tests in whom the result of the test will change what we do. And I can't be more specific than that, but in healthcare, we're very familiar with that because that's how we operate with all tests. We would not order a test if it's not going to change our recommendation or our treatment or the guidance that we might offer to somebody. So, you know, right now, people who are hospital, people who are sick, people who are critical, you know, those are the people that we want to prioritize. People who are generally at home, feeling well, you know, you are very likely going to be in the 80% of people who have the infection who will recover fully with little to no symptoms.
And you have a follow-up, Brad?
Yeah, how are we going to get through this with mitigation alone if we're not looking at adding additional beds, additional ICUs, additional respirators or ventilators? How are we going to get through this relying on social distancing alone?
Because that's how it's done. Mitigation is how we decrease the overall need for those high-intensity services. Mitigation is how we pace the need for those high-intensity services. If we're relying on hospital beds and ICUs only, that is not the right approach. We need an all-hands-on-deck approach in the community so that we do not need to rely on that capacity. We need to rely on one another to make the right decisions, to think very thoughtfully about how their actions may be impacting other people, and to prioritize the people who are at most risk. Again, the people who are older and the people who have medical risk factors. That is how we will get ourselves through this. And, you know, we cannot rely only on healthcare. We have to rely on one another here in this community to do the right thing by their fellow residents.
Okay, I'm going to now ask County Executive Bello to come and give a closing statement. I know you have additional questions. Please email them to me, and I will do my best to get them answered. We really want to let these gentlemen get back to work. Thank you.
Okay, thank you. I'd like to thank, again, the Rochester Press Corps for working with us to be able to provide this information to the community in a safe manner. I'd also like to thank all the folks who participated in today's press conference to make sure that we're getting out as much information as we can to the public. And so I also want to thank the community who's watching from home. I know there's a lot of anxiety out there and a lot of uncertainty because a lot of what we're doing today, we've never done before. And I know that can create anxiety. I know some people are panicked, and I see it. I was at Wegmans last night, late shopping for my family, and talked to a lot of residents. And we're going to get through this. We are a great community, and we are going to do what we do best, is we're going to come together, and we're going to support each other, and we will get through this. I want to thank the media for their role in getting the information out. And I'd ask the public at home to continue to watch the media and continue to follow the news so that we can make sure that everyone is informed on where we are. I want to thank the medical community and first responders who are working day and night, 24 hours a day, to protect and to heal the community all across Monroe County. I want to thank the government officials and my partners who are doing their job to pull resources together and make sure that we're coordinated and that we're collaborating across systems throughout this community. Because that's what's really important. The role and the big function that government officials can play is making sure that our systems are talking to each other. And I also want to thank the community and do a call to arms, that we all have a role to play. Our media, our medical professionals, our government officials, but every single person who's at home and across this community has a role. And your role is to stay home. Your role is to help vulnerable people in this community to make sure that they have the supplies and they have the resources that they need as well. I would also ask you to please pray for those who are in the hospital, who are suffering from COVID-19, and for the family of the individual who passed away yesterday. I want to thank again all of my team in Monroe County government. Because we're practicing social distancing, I don't get to see them as much as I'd like in person, so I'd like to thank them for their work. I'd like to thank particularly the Monroe County Department of Health, who again is working tirelessly to protect and keep us safe. And again, I'd love to be over to see them more often, but it's just better that we keep our distance and essentially and communicate by phone. And I'd also like to thank all of those in this community who are working in essential services that are making sure that we keep those supply chains and keep making sure that we have the resources that people in this community need. We will get through this. I am confident in that. We have seen an outpouring of love and support from community organizations all over Monroe County, from our nonprofit community, our school districts, our government officials. What we're facing now knows no geographic or political boundaries, and the response from this community has been the same. And so we will continue to confront this. We will continue to communicate. But I'd ask that we all look internally at what we can do ourselves in the professions that we're in and in our family life and home life to make sure that we're doing everything we can to flatten the curve and practice safe social distancing techniques. Thank you.